Good afternoon and welcome. I'm Javier Nieto, Dean of the College of Public Health and Human Sciences at Oregon State University, and it is my honor to introduce Dr. Camara Phyllis Jones as our 2020 Bray Health Leadership Lecturer. We are here today thanks in part to the generous gifts to the Tammy Bray Endowment in Health Leadership and Innovation. This fund was established by Dr. Bray, my predecessor and founding dean of the college, and her husband John, as well as with numerous contributions from other supporters of the college. I would also like to thank the OSU Foundation and Alumni Association for their support organizing this event. The session also serves as the kickoff for the college Friday research seminars for this academic year. Of course, we would have liked to host Dr. Jones and all of you on campus for the lecture, but absent that, it's really exciting to see a packed webinar room with more than 1,000 people in attendance. Many in the audience will be maybe new to our college or to public health, and I would like to extend a special welcome to them. Our college vision is lifelong health and well-being for every individual, every family, every community. We believe that health is a basic human right, and our work is to create conditions for health and well-being for everyone. And for that, a critical part of our mission is addressing the fundamental root causes of health inequities and poor health. We see racism as a fundamental threat to individual and collective health and a major barrier to equity. The growing protests against police violence and systemic racism have prompted a national dialogue that challenges all of us to confront racism at all levels, to move outside our comfortable race-neutral position and examine the fabric of our communities and our institutions with a social justice and anti-racist lens. This is the only way to end more than 400 years of racist violence and injustice. We are all responsible. We are all accountable. For us in the College of Public Health and Human Sciences, this national discussion underscores our goal to dismantle the racist systems and structures that keep health out of reach for too many people, and aspire to be thought leaders and contribute to the growing calls in our state and our nation to declare racism as a public health emergency. Towards that aim, we are pleased to have an international leader in anti-racist work here with us today, virtually that is, Dr. Camara Jones. She is past president of the American Public Health Association, just completed her tenure as the Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Studies at Harvard University. She is currently Senior Fellow and Adjunct Associate Professor at the Morehouse School of Medicine in Atlanta, Georgia, and Adjunct Professor of Public Health at the Rollins School of Public Health at Emory. From 2000 to 2014, she served as Medical Officer at the Centers for Disease Control and Prevention. Dr. Jones serves in numerous advisory and professional leadership roles in national efforts to eliminate health disparities and achieve health equity, including serving as a member of the National Academy of Sciences, Engineering, and Medicine's Roundtable on Black men and Black women in Science, Engineering, and Medicine. She is the recipient of the Wellesley College Alumni Achievement Award and the John Snow Award from the American Public Health Association, among many others. Praised for her compelling clarity on issues of race and racism, she has delivered 8 commencement addresses over the past few years. Dr. Jones earned her MD from Stanford University School of Medicine, her Master's in Public Health and Ph.D. in epidemiology at the Johns Hopkins School of Hygiene and Public Health, where we actually coincided as graduate students. I had the pleasure of sharing many hours of class and homework sessions with her, and completed residence training in general preventive medicine at Johns Hopkins and family practice at Montefiore Medical Center. We look forward to learning from her, to engaging in dialogue, and to continuing to forward our vision. Welcome, my dear friend, Camara.
Thank you very much, Javier. And I'm really, really delighted to be with you all virtually. And I am going to share my screen and share some thoughts, hopefully some conversation and thought producing frameworks and stories and the like to help us go from acknowledging, as you'll see in just a moment, that racism is a public health crisis, to saying, okay, well, now that we acknowledge that, what are we going to do? So let me start by saying that 4 years ago, as the president of the American Public Health Association, I launched our association, and as many other partners and communities, other associations, our state affiliates, whoever would join us, in a national campaign against racism with 3 tasks: to name racism, that is to say the whole word, which is so important in the context of widespread denial in this country, but to go beyond naming racism, to ask the question, how is racism operating here, to identify levers for intervention, and then to organize and strategize to act. So in the next 40 minutes or so, I want to give you tools to do each of these things. The tools will include some of my allegories on race and racism. And when I tell you a story, I want you to feel that story so much that you remember it and can share it with somebody in your household or in your social network today. But before we get into the storytelling and the framing, I just want to say, when in 2016, I launched this national campaign against racism, that was all well and good. You know, even at the American Public Health Association, I was writing monthly columns and the editor was like, Camara, are all of your columns going to have something to do with racism? And I said, yes. I was like steadfast. But it wasn't until 2018, when the Wisconsin Public Health Association adopted a resolution that racism is a public health crisis, and then May of 2019, when Milwaukee County, the Board of Commissioners, made a declaration, a formal declaration of that this became something that really took root. So May of 2019, Wisconsin, Milwaukee County in Wisconsin. Then Illinois, Cook County in Illinois joined. So I'm not pointing out just the counties, but the states that have any jurisdiction. By now, there are about 110, at least 110 governmental jurisdictions that have made such a declaration. But you can look at the epidemiology of the spread of ideas and the spread of agendas. As you can see, here we are in November of 2019, December of 2019. This is all before COVID. You remember COVID just was becoming apparent in China at the time. May of 2020 now, we had more people. COVID was here in the US, and actually Milwaukee County, the first to declare racism to be a public health crisis. Milwaukee was the first city to actually publicize the racial disparities in infection rates and death rates from COVID. And it was no accident. They already knew that racism was a public health crisis. So when you have this pandemic coming through, they knew to ask the question. But by the time you got to June, all of a sudden, boom, jurisdictions, cities and counties, and at least 5 whole states declared racism to be a public health crisis. Why? Because of the murder of George Floyd on Memorial Day, May 25th, with a knee on his neck for 8 minutes and 46 seconds. Then more states are still adding, July. And now in September, we have 25 states out of our 50 states that have at least one county or city. I think Ohio is the winner with 18 jurisdictions within the state that have made these formal declarations. This is great. It is important for governmental, this is not even the state, the city health department or the county health department. These are the city councils and the county boards of commissioners making these declarations, putting a stake in the sand, saying, public, hold us accountable, not only for recognizing racism, but its impact on really the health and well-being of our jurisdiction. And furthermore, please hold us accountable. So this might be a surprise to some of you all that 25 out of our 50 states have at least some jurisdiction that's made this declaration. And really, I have to say that the challenge for all of us is around 4 key messages. So these are the 4 key messages that at the end, I'm going to have equipped you to answer. First, the first key message for everybody in this country to understand is that racism exists. The second is that racism is a system. The third is that racism saps the strength of the whole society. And the fourth is that we can act to dismantle racism. So with that as the background and the framing, let's turn to our tools. This first tool is my allegory, Dual Reality, a restaurant saga, a story based on something that happened to me in my own real life. And the moral of this story, I'll just tell you, is that racism exists. Even understandable for people who have thought their whole life that this was the land of opportunity. So let me tell you what happened in my own real life. As a first-year medical student, I was, of course, very studious, very diligent. Wake up on a Saturday morning, and what do? I hit the books, studying, concentrated. Gets to be about mid-afternoon, and some friends come over. Do they distract me? Oh, no. We all start studying long and hard, and now it's getting late, and we're getting hungry, and I have no food in the apartment, which was quite typical. So my friend said, never mind, Camara, we understand, but we are hungry. Let's go into town and find something to eat. So we do, we walk into town and we find a restaurant and we walk in and we sit down and the menus are presented and we order our food and the food is served and here we are eating. And you're like, Dr. Jones, that's not a very illuminating story about racism? Oh, no, not yet. But as I sat there eating with my friends, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now maybe I've intrigued you and you're like, Dr. Jones, what did the sign say? Oh, okay. What did the sign say? The sign said open. So now maybe I've lost you, or at least some of you. So let me recap. Here we are, sitting in a restaurant eating. I look across the room, I see a sign that says open, thinking nothing more about it. I would assume other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that now indeed the restaurant was closed to the hour, but firmly closed, and that other hungry people just a few feet away from me, but on the other side of that sign, would not be able to come and sit down, order their food and eat. And that's when I understood that racism is structuring open, closed signs in our society. That racism is structuring, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on because it is difficult for any of us to recognize a system of inequity that privileges us. It is difficult, for example, for men to recognize male privilege and sexism. It is difficult for white Americans to recognize white privilege and racism. It's difficult for all Americans to recognize our American privilege in the global context. But those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, but if you do, why, you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door, let them come in? You'll make more money and oh, the conversations we could have. Or maybe what you'll do is pass food out the window, or maybe you'll try to tear down that sign or break through that door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So I tell this story when I just have 4 or 5 minutes to convey to a group of people that yes, racism exists. It's structuring open closed signs in our society, two-sided or multi-sided signs, creating a dual or multifaceted reality. And of course, racism is not just the sign, it's the door, it's the lock, it's like so much there. I am heartened that in these past 6 months or so, did you see how that map of jurisdictions declaring racism to be a public health crisis blew up in June, and that there's still more states with jurisdictions adding to that map? I am heartened that more people who are born inside the restaurant, right? In fact, I once asked a question that started a 3-hour conversation, which is, how could people who are born inside the restaurant know something about the two-sided nature of that sign? And actually, it was a 3-hour conversation because there are many ways to know. But I am heartened that more people who are born inside the restaurant have a sense. They got a flicker. I don't know if the air conditioning went on high in the restaurant or what, but they got a sense that this is a two-sided sign. So more people are doing the thing of naming racism. You know, companies making declarations and organizations, and as I said, these 100+ jurisdictions, they are doing that work, which is crucial work, essential work. We must name racism. But I have to warn you, all of us, that if we just say a thing, put out a declaration, name racism, assert that Black Lives Matter, put together the words structural racism or systemic racism. But if we just say a thing, the staunch racism denial in this nation is so seductive that in 6 months, we may forget why we said that thing, and we may fall back into what I describe as the sleepiness or the somnolence of racism denial. So that's why it's important for us to go beyond saying structural racism, systemic racism, and the like, to acting. We need to tear down the sign. We need to dismantle the lock. We need to take the door off the hinges, because if we are acting, we will not forget why we are acting. But now I know I owe all of us a definition of racism. So when I say the word racism, what do I mean? Well, I am clearly talking about a system. So I am not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested. And clearly, yes, racism can manifest in those ways, but in its essence, racism is a system of power. And a system of doing what? It's a system of doing two things: of structuring opportunity and of assigning value. And on what basis is the opportunity structured? And on what basis is the value assigned? It's based on so-called race, based on the social interpretation of how one looks in this race-conscious society. And I used to do an hour-long lecture on what is race. So I don't have an hour right now, although if you want me to go more deeply into what race is and what race isn't, we clearly know race is not biology. We've mapped the human genome. There's no basis in the human genome for racial subspeciation. Race is not culture. These big racial groups that we have include people who are from many different ethnic groups with different histories and cultures and languages and health beliefs and cultural practices. Race is not social class, right? Even though there's an association between race and social class in this country because of structural racism. I will go more deeply into that. But what race is the social classification of people in a race-conscious society, which has operated throughout history and day to day, even today, as the substrate on which racism operates to structure opportunity and assign value. And this system, the racism, has many impacts. The first of which is, when we do understand that, racism exists, we acknowledge that racism unfairly disadvantages some individuals and communities. However, it should not take any of us very long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about, because it makes some people, especially some white people, uncomfortable. And I've talked to lots of audiences and groups for decades now. And so I used to, when I got to this part in defining racism and the unfair advantage, I used to say, I know I may have made some of you uncomfortable. If I did, shake it off, stay with me, I'll tell you more stories. I don't apologize like that anymore. What I say is, if I have made you uncomfortable, I encourage you to lean in, because I have come to recognize that for each of us, the edge of our comfort is our growing edge. But there's a third impact of racism that many of us miss, and that is that racism is sapping the strength of the whole society through the waste of human resources. And actually, I need to add to this part of my slide to say, and through the way that it divides this nation right now politically. What do I mean by that? Take, for example, the phrase Black Lives Matter. It's not just that Black lives matter. Black lives are genius. Black lives are precious. They are leadership and creativity and generosity and love. And when we constrain Black lives and Indigenous lives and Latinx lives and Native Hawaiian, other Pacific Islander lives and Asian lives and all of these racialized lives, when we constrain those lives slowly by not vigorously investing in the full, excellent public education of all of our kids, because decision makers might, are wearing these blinders that make them think there's no genius in the barrios or the ghettos or the reservations. We can get along very well, thank you, without those kids. When of course there is genius in all of our communities. And if we were only to vigorously invest in that genius, we could be doing so much better as a nation or as a world. When we constrain these Black, Indigenous, and other people of color lives slowly by being complacent with the wholesale warehousing disproportionately of so many Black and brown men in our prison system, as if that didn't separate us from human potential, or when those lives are snuffed out in an instant with a barrage of police bullets or a police officer's knee, that is not just a problem for the individual and the community, the family that's been mortally wounded. This is a problem for the whole society, because each of these losses saps the strength of the whole society through the waste of human resources. I want to say one more thing before I leave this slide, which is that I have come to know through all of my experience, speaking to people on these issues for decades, that there are many people in this country who think that there are two states of being in this country. Yes, there's disadvantaged, but the other state is normal. And the reason that people in this country think that there are two states of being, disadvantaged and normal, is that we as a nation are ahistorical. We act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. And people do not recognize that their so-called normal is built up on a whole mountain of unfair advantage. But now I'd like to turn to a framing for understanding how could racism, how could this system of structuring opportunity and assigning value turn into health outcomes? How could it turn into differences in asthma prevalence, for example, or obesity prevalence, or differences in the numbers of our babies dying before their first birthday, the infant mortality rates, or differences in the numbers of our mothers dying within a year of a pregnancy, the maternal mortality rates? How could racism turn into the differences in diabetes prevalence and heart disease prevalence and kidney disease prevalence that are now the so-called pre-existing conditions that are making people once infected with COVID-19 more likely to die? And so to understand how racism can turn into health outcomes and what we should do about that, I distilled this paper that I'm going to be presenting now. I published 20 years ago. I've been telling this story for almost 30 years. That's going to illustrate this framework. 3 levels of racism: institutionalized, which is now what we call structural racism. So when I say institutionalized and structural, they're the same thing. Personally mediated racism, which some people describe as interpersonal racism, although I so clearly understand racism to be a system that I say personally mediated racism because it's the system mediated through people. And internalized. So I want to define each of these levels for you, briefly give you examples of how they can impact health, and then illustrate them with another one of my allegories, my gardener's tale. So institutionalized or structural racism is actually the system, if you will. It's the constellation of structures, policies, practices, norms, and values which taken together result in differential access to the goods, services, and opportunities of society by race. This is the kind of racism that does not require an identifiable perpetrator because it's been institutionalized in our laws and customs and background norms. This is the kind of racism which shows up as inherited disadvantage or its reciprocal inherited advantage. We see this level of racism in terms of material conditions as well as in terms of access to power. So examples include differential access by race to quality housing or excellent educational opportunities or equal employment opportunities or even the same level of income at the same level of employment. And clearly those things can impact health. It shows up as differential access to medical facilities, which could be, physical proximity access or financial, insurance access, or even linguistic access. It shows up in terms of differential access to a clean environment and the very well-documented disproportionate placement of toxic dump sites or bus transfer stations or, testing of atomic bombs and the like in communities or islands of color. And in terms of access to power, structural or institutionalized racism shows up as differential access to information, which could be health information or even information about our own histories. Differential access to resources, not just capital resources, but social networking resources, knowing somebody on the board, and differential access to voice in media, in government, and the like. Now, I have in the past gotten a very important question just at this point in my presentations, where somebody might say, excuse me, Dr. Jones, would you please take a careful look at that top list of examples where you talk about housing, education, employment, income. Dr. Jones, isn't that what we call social class? Why do you have that on a slide about racism? Are you talking about racism? Are you really, really talking about social class? Many of you might have that same question. It's a very important question, so let me answer it. And the first part of my answer is the observation that it doesn't just so happen that people of color in this country are overrepresented in poverty, while white people in this country are overrepresented in wealth. That's not just a happenstance. And for each marginalized or stigmatized or oppressed group of color, there's been some initial historical injustice. So, for example, for American Indians, the initial historical injustice was the taking of the land and the near genocide, and then moving the survivors to reserve lands. And then in some instances, something good was found under one reservation. Oops, you got to pick the people up and move them somewhere else. You know, I am limiting how much detail I go into because I would just kind of quickly list a bunch of different groups within, these injustices. So for example, Mexicans who for centuries lived in Mexico, never crossed the border, but the border crossed them, right? And now their grandchildren and great-grandchildren are being harassed and killed, right? There are, the Chinese laborers brought over to build our railroads in this country, unable by law to bring their families and unable by law to marry. There's the internment of Japanese Americans during World War II, but not the internment of German Americans or Italian Americans. For people of African descent, the initial historical injustice was the kidnapping of West African people, and then our importation across the Atlantic with tremendous loss of life in the Middle Passage. And then for the survivors and their progeny for generations and generations, what I describe as the coerced usury of our unpaid labor for centuries to build this country. Now, sometimes people have heard me talk like this and they go, oh, Dr. Jones, there you go talking about slavery. Dr. Jones, we all recognize that slavery was an unfortunate chapter in our nation's history. But Dr. Jones, the enslaved people were emancipated by 1865, and we are now in 2020, which makes that 155 years ago. So all else being equal, Dr. Jones, don't you think the impacts of slavery would have washed out by now? Well, the answer is actually in their question, all else being equal. All else has not been equal since 1865. And all else still is not equal today. And there are what I describe as present day, contemporary structural factors that are perpetuating that and all of these other initial historical injustices. And these contemporary structural factors are part and parcel of institutionalized or structural racism. So when you ask me, am I talking about racism or am I talking about social class? My answer is that structural or institutionalized racism explains why we even see an association between social class and race in this country. This is a very important aha. It does not just so happen, right? Now, I want to address a question that I've gotten before too, which is like, well, if you just focus so much on racism, does that mean you don't care about poor white people? No, au contraire, I care deeply about poor white people, poor Black people, poor Indigenous people, poor Latinx people, poor Asian people, poor Native Hawaiian, other Pacific Islander people, poor all kinds of people. And we absolutely need very vigorous anti-poverty strategies indeed. But what I have to warn you about is that even if you brought me a magic wand today where I could ding eliminate poverty, I would use it. And if with a double ding, 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 I could go beyond eliminating poverty to equalizing income, I would do that too. But even if I were able to do that today, if I did that without addressing the background structures, policies, practices, norms, and values, the mechanisms of institutionalized or structural racism, if I equalized income today but did not address racism, then within one generation, we would start to see a stratification by race again in terms of income. So this is not an either or proposition, anti-poverty versus anti-racism. This is a both and. Before I leave this slide, one more thing I must say, which is that structural racism can occur through acts of doing, acts of commission, as well as acts of not doing, acts of omission, and very, very often, this level of racism shows up as lack of action, inaction in the face of need. The second level of racism that I will describe, personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. So this is what most people think of when they hear the word racism. Somebody did something to somebody. It includes the different idea, the prejudice, and the different action, the discrimination. And there are many ways that this can impact health. Police brutality, when a police officer interprets a person's cell phone as a gun, Stephon Clark, and kills them in their grandmother's neighborhood. Or when, the assumptions about intents of selling onesies results in the strangulation, death, and the chokehold of Eric Garner, and on and on and on. And this police brutality is not just, as I said, sapping, the strength of the society through the loss of the individual. It's not just deeply hurting the family forever that's been injured, that's been mortally injured. But there are communities, whole communities who are just bracing ourselves for the next occurrence, because for the most part, there's been very limited accountability for these acts. Physician disrespect, that can be as subtle as a physician not giving a patient the full range of treatment options because the physician figures, well, that patient couldn't afford or wouldn't comply or wouldn't understand or whatever it is that they assume. Or it could be quite blatant, like sterilization abuse, which has had many iterations in our nation's history. And apparently is happening in Georgia, where I live, for women who are detained at the ICE detention centers, even right now. Shopkeeper vigilance, being followed around in stores, or waiter indifference, not getting quick, respectful treatment. These are just two examples of what some people describe as everyday racism, the microaggressions, the subtle communication of disrespect, which might be related to elevated blood pressures in communities of color, blood pressures that don't even go down at night. And teacher devaluation, that's a very important manifestation of personally mediated racism, because if a teacher looks at a young child and thinks, that child can't learn, that teacher, and then the teacher puts that child off in the attention deficit disorder track, the child will never even know their full potential, much less have the opportunity to develop to their full potential. Like structural racism, personally mediated racism can be through acts of doing, as well as acts of not doing. But even more important is to recognize that this level of racism can be unintentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism, internalized racism, I define here from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. I do agree, as many of my friends who do anti-racism training, used to say, Camara, what about the internalized sense of entitlement that many white people walk around with? Isn't that also internalized racism? I agree. It's not on this slide because, how does internalized sense of entitlement, how is that related to bad health outcomes? But I actually have a little inkling now that maybe if you have a sense of entitlement thwarted, then maybe that's related to what some people are describing as the diseases of despair in white populations, the entitlement thwarted. So the suicides or opioid epidemic and the like. But the rest of this slide is still from the point of view of members of stigmatized races, where internalized racism shows up as self-devaluation, feeling maybe I'm really not as good as, maybe I shouldn't try to graduate from high school or apply to that college or try to get that job or live in that neighborhood. It turns into the white man's ice is colder syndrome. That phrase I first heard from my parents' generation, and what it meant for people of color at that time, it still means for many of us today. So say that I'm Black and I need a lawyer. I might actually seek out a white lawyer over a black lawyer. Or if I'm sick, I might prefer the white doctor over the black doctor if I could find a black doctor. Or if my lemonade were warm, I might go way down the street to get the white man's ice over the black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. It shows up as resignation, helplessness, hopelessness, which turns into a lot of self-destructive health behaviors. It turns into not registering to vote and not voting even if we are registered. And so I have to just do a little segue right here. People, 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 we cannot let that happen. With all of these efforts to disenfranchise so many parts of our citizenry in this country, we must all register to vote and all vote and make sure that everybody we know is going to vote too and makes a plan. But I digress. Internalized racism is about members of stigmatized races accepting the limitations to our own full humanity of the box into which we've been placed. So that when we hear young high school students of color, and one of them is trying to be the valedictorian and the others are teasing her or him by saying, well, you know, so-and-so is just trying to be white. We need to challenge that, because since when did white people claim exclusive access to excellence? They did not. So now I'd like to illustrate these three levels of racism and their relationships and what we need to do with another of my allegories, my Gardener's Tale allegory. So I'm going to stop sharing right now so that I can use your full screen and use my hands to full advantage. So let me tell you this story, which is based on an experience I had. First, let me just tell you the real experience I had, and then we'll make it a story about racism. So my husband and I had been married about a year, and we moved down to Baltimore for me to finish my Ph.D. at Hopkins, right, Javier? And we bought our first freestanding house. Cute little house with a big wraparound porch with flower boxes dotted all on the porch. And we bought this house in October, so that really wasn't the time to plant. But when spring came, my husband, who loves to garden, ran out with our marigold seeds, going to decorate our cute little house. But then he walked right back in. And he said, Camara, you know, some of these boxes have dirt in them, but some of the boxes are empty. I need to go to the gardening store. So he does. He goes to the gardening store and he comes back hauling big old bags of potting soil, right? And then we fill up the empty boxes. And then we take equal numbers of our marigold seeds and put them in all of the boxes, and we water all of the boxes equally. And by this time, because I'm not the gardener in the family, I'm exhausted. And I'm like, you know, I'm going to sit back and just be delighted. Well, about 3 weeks later, as I'm walking out of my front door, I finally pay attention to these flower boxes on my porch. And what I saw made me literally stop in my tracks. Because what I saw made me think we had planted completely different species in some boxes versus others. Because some of the boxes were full of plants and they were tall, vigorous looking plants. And some of the boxes just had a few plants in them and they were kind of scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had bought turned out to be rich, fertile soil, so that every single seed planted in the potting soil sprouted. The strong seed grew very tall and vigorous, but even the weak seed made it halfway up. But that old soil that we had found there turned out to be poor rocky soil. So the weak seed planted in the poor rocky soil just died, and even the strong seed in the poor rocky soil had to struggle to make it to a middling height. Maybe some of you guys have seen this. Maybe you're gardeners. Maybe you've composted half of your garden. Maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the soil, the importance of the environment. But now I'm going to make this a story about racism by introducing a gardener. So now we're going to have a gardener who has two flower boxes, one which she knows to have rich, fertile soil, and one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, and some of the seed is going to produce red blossoms. And the gardener prefers red over pink. So what does she do? She takes the red seed, she puts it in the rich, fertile soil, pink seed in the poor, rocky soil. 3 weeks later in her garden, she sees what I saw in mine. In the rich, fertile soil, all the red seed sprouts, strong red seed, tall and vigorous, weak red seed makes it halfway up. In the poor, rocky soil, the weak pink seed dies. Here comes the strong pink seed just struggling to make it to a middling height. And then in those flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year after year, same thing happens until finally, about 10 years later, the gardener is looking at her flower boxes and she says, you know, I was right to prefer red over pink. So we're going to stop the story, interrupt the story right now to say the first part of this story is how institutionalized racism works, where you have the initial historical injustice of the separation of the seed into the two types of soil. You have the structural factors of the flower boxes keeping the soil separate. and then through inaction in the face of need, perpetuation of the inequity. But let's pick the story back up to say, well, where is personally mediated racism in this garden? Well, the gardener's looking over at the red flowers thinking, oh, those red flowers are so pretty. And then she looks at the pink flowers and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. She plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not acknowledging or perhaps not even understanding that they're benefiting from enriched soil. The pink flowers are looking over at red thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, minding their own business, collecting nectar, but pollinating at the same time. So here comes a bee into one of the pink flowers and then to another pink flower and to this pink flower, and this flower's like, get away from me, bee. Don't bring me any of that pink pollen. I prefer the red because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism. So we can go over to the pink flowers and we can say, pink is beautiful, power to the pink. And that's a very important intervention. But if that's all we do, it's not going to change the situation in which those pink flowers find themselves. So you say, oh, okay, well, let's address the personally mediated racism. Let's have a conversation with the gardener. Or better yet, let's have a workplace multicultural workshop for the gardener. So we do. So in our workshop, we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will, maybe she won't. But even if she does, it's still not going to change the situation in which those pink flowers find themselves. If we really want to set things right in this garden, we must address the structural or institutionalized racism, which means we have to break down the boxes and mix up the soil. Or if you want to keep separate boxes, that's all right too, although it does make it easier for that same gardener to continue segregating resources going forward. But if you decide you need separate boxes, then that means you need to enrich that poor rocky soil until it is as rich as the rich fertile soil. And when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious, so that in that intervention, you will have also addressed the internalized racism, because pink will no longer be looking over at red, thinking red is better, or wanting to be red. And in the intervention on the structural or institutionalized racism, you may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful would be less likely to have that kind of attitude. So this story has been to illustrate these three levels of racism and to strongly suggest that if we want to set things right in the garden, we need to at least address the structural racism, good to address all the levels at the same time, but at least address the structural racism. And when we do, the other levels may take care of themselves. But there's a very important question that I haven't asked yet. So let me just get back to our place where we were. And that important question is, who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act, and control of resources, which are actually elements of self-determination. Who is the gardener? Well, government is a huge part of the gardener, but not the only part. Media, foundations, corporations, communities, to the extent they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red, that's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. And so our challenge now is, what do we do about the gardener? Do we make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow or recruit their own gardener? Lots of questions can come out of this story. And I hope to be able in just a moment to take some of your questions. But before I transition toward the end of my talk, I want to share two questions that have come up before from this story very quickly. The first was when I was asked early on, Dr. Jones, why should the red flowers share their soil? And when I heard that question, I loved that question because it showed me the power of this story to start conversations about racism, which might be otherwise difficult if we were talking about racism between you and me. My answer to that question, why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers. It belongs to the whole garden. But here's a second very important question, which is, what if that's not the original gardener that we're looking at right now? What if that's the gardener's great, 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 great grandchild? here we are. And the great-great-great-great-grandchild has always seen the flowers looking like this, may not even think there's a problem to be solved. So in 3 quick steps, here's what we need to do. First, we must make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution. And then to solve it, the second step is that we must make those flower boxes transparent. We must be talking about the differences in the quality of the soil in order to address those differences, the root causes. And the third thing is, as we make those flower boxes transparent, we must make sure that everybody knows that the pink seed did not just go launch themselves into that poor rocky soil. So we must talk about history, and we must talk about how the gardener's initial preference for red over pink, what some people call cultural racism, what in our setting is white supremacist ideology, how that set up the whole situation. Because if we do not, even if we were to compel that red gardener to enrich the poor rocky soil today until it was as rich as the rich fertile soil, if she continues to prefer red over pink, she will continue to privilege red over pink going forward. So when I defined racism as a system that does 2 things, structures opportunity and assigns value, we must address both of those things if we're going to set things right in the garden. Very quickly, when I talked about my national campaign against racism, I said we need to name racism. Now I've given you a lot of tools, definitions, frameworks, lots of stuff to name racism. But the second step was to ask, how is racism operating here? And that's a legitimate question, because racism is not a cloud or a miasma. It's a system with identifiable and addressable mechanisms, which are in our structures, policies, practices, norms, and values, which are the different elements of decision-making, where structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and values are the why. And I encourage us to take this question with us everywhere. How is racism operating in my workplace, at my child's school, with regard to police killings of unarmed Black and brown men and women? And I don't have time to just lift up each of these, but when we think about each of these mechanisms, that provides us a lever for intervention, a target for action. Or how is racism operating here with regard to excess deaths of Black and brown and indigenous people from COVID-19, where the problem is, first of all, that our communities are more likely to become infected because we're more exposed and less protected. And then once infected, we're more likely to die because we're more burdened by chronic diseases with less access to healthcare. How is racism operating in that? Again, I don't have time to go into detail right now. I would just flash these things up, but happy to answer your questions there. What I need to do is round it up so I can hear your questions. What can we do today? Because the third of those 3 tasks of my national campaign against racism is to organize and strategize to act. So going back to that image from the restaurant saga, we need to actively look for evidence of 2-sided signs. Is there something differential going on here by race, by immigration status, by gender, by language, by zip code, by rural, urban, by religion, by any aspect? And we need to look, not only is there something differential going on in our outcomes, but also in our opportunities and exposures, resources, and risks. We need to burst through our bubbles of humanity to experience our common humanity. Each of us is in a bubble of experience, our children and families and our work and their schools and community and faith groups if we have. And often, most often in our bubbles, we do not recognize that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We as individuals and as organizations need to create opportunities to burst through our bubbles to experience our common humanity in different circumstances. We need to be interested in the stories of others. Don't be so self-centered. And then believe the stories of others without requiring cell phone documentation. We've had cell phone murders of Black and brown men and women for at least 20 years. I'm glad that the murder of George Floyd seemed to have been maybe a step too far, but we need to believe the stories of others even without cell phone documentation. And then we need to join in the stories of others, which I'm so happy that so many of us are doing across this country. We need to develop a sensitivity to the absence of who is not at the table. And whenever you find yourself at a decision-making table, I encourage you to look around and say, who is not here, who has an interest in this proceeding? And then your job is not just to represent their interest, your job is to find them a way to the table, to create space. Who is not here at the table, what is not on the agenda, what policies are not in place that if put in place would be quite productive. We need to reveal inaction in the face of need, because that is how structural racism most often manifests these days. The system is put in place, it's on autopilot. Doesn't require an identifiable perpetrator. We need to reveal inaction in the face of need. But all of the strength and power is not just on those on the side of those inside the restaurant, because those on the outside, we need to know our power. We need to recognize that action is power, and especially that collective action is power. So I'm so delighted to have been able to share these thoughts with you, and I look forward to our discussion now. Thank you very much.
Well, thank you, Camara, for such an inspiring lecture and talk. We have a bunch of questions in the Q&A. There are a few people who took issue with your, or was struck by your map early on in the presentation, where Oregon doesn't show as having any jurisdiction to declare racism as a public health. I don't know if you have any comments on that, but just to say, I also, another participant in the webinar pointed out that actually OPHA, the Oregon Public Health Association, is currently, as we speak, working on a proposal for a legislative concept, precursor of a bill, to declare racism as a public health crisis in the state and dedicate resources for action. So this
I am delighted to hear that. At the bottom of the slides, I said that my data source were all of the declarations that have come to the attention of the American Public Health Association. So these were the ones there. So there was not one from Oregon, but they're also, I mean, from yesterday to today, they added 3 new states. So they are always, if you go to, if you look back at the slides, apha.org/topics and issues / declaration or whatever, you can actually let them know about your efforts. But these are from jurisdictions, so not even just the public health associations. I'm sure almost all public health associations and hospitals, there's a lot of people now making these declarations. We need to know what's happening in Oregon. We need to know what you guys are doing there. So,
unrelated question from an anonymous attendee who says, our local health department recently joined the many who named racism a public health crisis. My fear is that we will pat ourselves on the back and not act on this statement. What do you think local departments need in place in order to move from naming racism to action?
So the first thing is who's talking about it. So the first thing at the health department or the city council or whichever the jurisdiction needs to partner with community folks, especially in communities that are on the disadvantaged side of the racism equation. Racism is sapping the strength of all of us, but there are those who are being disadvantaged right now because people in communities are trying to solve their problems right now. But often they aren't given voice at other decision-making tables. They're not invested in, they're not partnered with. So the first thing is, who is the group that is going to decide on the actions forward? It should not just be the same old, legislators or whatever. You need to reach and partner with community.
Thank you. A question from Alison Martin. Dr. Jones, when reading Listening to Your Gardening allegory, I can't help but think about the concept of resilience. Lately, I have been wondering if it's a concept that actually isn't helpful because it perpetuates institutionalized racism. Do you have any thoughts about this?
I have very strong thoughts about that. And so, yes, when people focus on individual resilience, then it's like, okay, we got you in the poor rocky soil, but you made it. What is it about those that made it in the poor rocky soil? And it's not even acknowledging the loss of all the other seed that is of equal promise. So I do not like the focus on individual resilience, but it makes me, if I could just have maybe a minute and a half to, something that I took out of my slides that I need to communicate. That focus on resilience is just one manifestation of our narrow focus on the individual in this country. And the narrow focus on the individual is one of 7, what I used to call societal barriers to achieving health equity. I now articulate them as the values targets for anti-racism action. So I'm just going to quickly give them to you and why. The first is a narrow focus on the individual, which makes systems and structures either invisible or apparently irrelevant. When you're looking at that one resilient pink seed that made it halfway up, right? Then you're not looking at the quality of the soil and the flower boxes and the inaction in the face of need. The second is that we're ahistorical. We act as if the present were disconnected from the past and as if the current distribution of advantage and disadvantage were just a happenstance. The third is our endorsement of the myth of meritocracy, the story that goes something like this. If you work hard, you will make it. Now, I give you that most people who have made it have worked hard, although not everybody who's made it has worked hard. But yes, most people who have made it have worked hard, but there are many, many, many other people working just as hard or harder who will never make it because of an uneven playing field that's been perpetuated, structured and perpetuated by racism, sexism, heterosexism, capitalism, and all of these systems of structured inequity. And when we deny racism, we're endorsing the myth of meritocracy. We're blaming people who haven't made it for being lazy or stupid. And there are many ways to deny racism. One is to say, I don't think racism exists, which we've heard some people say recently. But another way is to never say the word racism. And you could be talking about all kinds of good stuff, you know, racial disparities or disproportionalities, diversity, equity, inclusion, cultural competence, race, all kinds of things. If you never say the word racism and get the ism out of your mouth, the system part, in the context of widespread denial, you're complicit with that denial. Very quickly for the other four. The fourth is our endorsement of the myth of a zero-sum game. If you gain, I lose, which puts us in competition. It's almost like I'm at a potluck dinner. I don't want you to come and sit down because I think you're going to eat all the food, and I don't recognize you bringing all kinds of cakes and pies and roast and salads with you. The fifth is our limited future orientation, which manifests as disregard for the children and a usurious relationship with the planet. The sixth is our endorsement of the myth of American exceptionalism, that the US is so special, so different, so ordained by God that we can't even learn from others. And the seventh is white supremacist ideology, which is not a lightning rod term. It is the description of a false idea of a hierarchy of human valuation by race, with white people at the top as the ideal or the norm, which gives people who are living as white a sense of entitlement. It results in the dehumanization of people of color and fear at the browning of America that's underlying a lot of our political divide today. These things are why racism denial is so staunchly held in our society and why we're not making progress toward equity. We need to address the structures and these values pieces.
Well, we have 1.5 minutes left.
I know, I'm sorry, but I just had to, but I just had to.
Any questions? I'm just going to give just one more. Please be very brief on the answer. It's a brief question. How can I help my peers lean into those uncomfortable circumstances you mentioned earlier? This is from Andrew Glass.
So ask them to read history. You know, we're ahistorical, to read history, to read, that's the most thing, read the local history of the place, the history of the nation, the history of the state. Ask them to do something outside of their neighborhood on a consistent basis. Don't kind of do some voyeuristic, you know, traveling through a different neighborhood, but to create relationships with other people. Those two things, bursting through our bubbles and learning the full history that we haven't been taught, would be a good first start.
Well, you finished quick. Let me just get another one. How do we, a question from Rupikaran Kaur, I think, something like that. How do we, as young adults of color, get our voices heard, even when we find our way to the table? We find ourselves away from the table.
So once you find yourself at the table and people still aren't hearing you. So it's good so people who are setting these tables need to not just bring one person who can be so easily ignored, right? So it's good to have, to bring several people who won't be saying the same thing, but at least they can see and hear each other. I think about it as finding your flock, right? So, you know, when geese fly in a V formation, the one at the front is breaking the wind for the ones who are coming behind. And I worry about the one at the front. When they get tired, are they going to just drop to the ground or fly off someplace random? They don't. They fly into the flock and somebody else takes the lead. What we need to do is find our flocks, find the people, and then decide what direction we're going to go on and take turns in leadership. A very practical thing to do, though, is if you're on a board, give them the 4-page Gardener's Tale allegory. Suggest that the board or whatever discuss this. You're not only trying to have them discuss it, but you're listening to how people discuss it. After the meeting, you go up to somebody, you say, oh, I really appreciated how you talked about that. Next time such and such an issue comes up, can you bring it up first, or can we, you know, you do the pre-meeting, but you have to find out who your flock is, who are your allies there, so that you're not always the one saying something and then they can just discount you. You need to create a flock.
Thank you, Camara. Thanks for everybody, the hundreds of attendees to the lecture. And thank you for a very, very inspiring and powerful lecture, Camara. Thank you so much.
Thank you for this invitation and opportunity. Thank you, Javier.